Okay. Great. Well, good afternoon. This is Lisa Witchey with the California Department of Social Services, and I'm glad to have you all on the webinar today. We'll start with some introductions for Department of Healthcare Services. Do we have Charles Anders on the line?
Hi, yeah, this is Chuck.
Oh, great. Hi, Chuck. Thanks for joining us. And do we also have Michael Cole with Chapin Hall?
Yep, I'm on.
Oh, fantastic. Okay, great. So I'm just going to start with some brief introductions in the room here at CDSS. Again, this is Lisa Witchey.
Good afternoon, Rebecca Buckmiller, Integrated Services Unit.
Jeffrey Koff, Integrated Services Unit.
Janine Lesour, CDSS.
Great. And then do we also have representation from CWDA? And you, did we unmute?
I'm looking right now.
Okay. Okay. We're going to work on unmuting folks right now. So we'll go ahead and get started. One thing that I did want to introduce is a change in format. What we really want to do is make sure that these webinar calls are interactive and that those of you who are participating have a chance to ask your questions in real time and also to learn from one another as you're working through your implementation and just learning more about working with the CANs within the CFT process. So we will be unmuting everyone who has joined. You may have muted yourself, which is great if you're not speaking, but just know that from our end, you are unmuted, and so you should be able to speak as you have questions. You'll also note that we've organized the agenda to be able to provide some updates at the beginning, but then have time for each of the regions to ask questions. So we're going to try out this format and see if this works better to be able to have a more interactive conversation. And we recognize that we will not be able to likely answer every question that comes up. And so we do encourage you to submit questions in writing to the 2 email addresses at the bottom of the agenda. And we are responding to those questions in writing. So those email addresses are cwscoordination@dss.ca.gov for CDSS. And then for the Department of Healthcare Services, the address is cmhpos@dhcs.ca.gov. So with that, I think we'll go ahead and move into updates. We are very excited to share with you all that we have released a CFT survey that is available now on the CDSS website on our main page. We do plan to issue an all-county information notice as well as an email blast through all of our distribution lists to announce that survey. The survey really is seeking to gather qualitative information from all child and family team participants. So children, youth, family, natural supports, and formal or professional supports, or participants of teams. Because we know that implementation of CFTs and the experience of CFTs is going to differ, and we really want to understand what child and family teams look like. We will be gathering that information and analyzing it on a quarterly basis, and then sharing that information with the individual counties and providing targeted technical assistance as well using that information. So the survey is 17 questions. It's anonymous. The indicator, though, we are collecting the county information so that we can circle back on an aggregate level with each county. So if you have questions about that, please email us, but do look for the announcement coming soon about that CFT survey. Up next, we wanted to share an update about the CANS automation. So Sinultra Sanchez, are you on the line?
Yes, hi, I'm on the line. Yes, and just to introduce myself to others that may be on the line, I'm the product owner for the CANS product here at CWDS Cares. And so just wanted to provide an update on the CANS application. Just a little correction from the agenda. It's not a website, it's an actual application. So users would that have access to CARES would be able to access CANS. We have finished up our version 1.0 of the CANS product, and we are in the process of getting that ready to be released on October 31st. At which point it would be rolled out to a set of counties that have been previously identified. We've been working with 7 counties. It would roll out to a small number of people in each of those counties probably on the 1st of November. And after that, it will be a phased approach to ultimately go statewide by mid-January. So that's the update for our 1.0 that we've been working on since May. And in parallel with that, we have started work on the version 1.1 and hoping to have that go out sometime the beginning of next year. So more formal communication would be released on that in the near future from the CWDS program. I don't know if there's anything, I know that was extremely high level. Was there anything specific that you would like me to go over, or is there any specific questions?
Well, we will have time for questions, but as we move forward, so I'll invite folks to ask those questions during the later portion of the agenda, but really appreciate that update, Sinultra. That's helpful.
Sure, thank you. I'll see you around on the phone for questions later.
Fantastic, thank you. We also wanted to share an update on the CANS website that we are developing. So we have web pages for child and family teaming and for the CANS. And we expect those web pages to be live within the next 2 weeks. So we have been gathering resources and information to make publicly available about the child and family team process and model and training resources, policy letters, and best practices. And then also information about the CANS, including information about automation, information like you just heard, information on training, and policy letters and other resources that can support your implementation of the CANS. So just wanted to share that that is in the works, and we should be able to announce at our next call on the 31st of October that those web pages are live. Also wanted to share an update on training, and I know that for the CANS, I know that some of our regional training academy directors and managers and staff are also on the line, and so I'll invite you, if you have updates to share, please feel free to jump in. We do have CANS, the CANS General Overview training available, and understand that while we are still working through many of the details around how the CANS aligns with and integrates into county practices, and particularly within the child and family team process, we're still really working through the details around that. But for some counties, you may be in a position where you are more ready to move forward. And so the regional training academies do have trainers that are certified and are in the process of scheduling trainings at a local level. We do encourage that if you are a county that is in a place where you're ready to move forward with your CANs and you're looking to build more understanding and knowledge around the CANs tool, that you attend that general overview training. We are focusing first on managers and supervisors to attend that training to start to build foundational knowledge around the CANs and familiarity, and really focusing your thinking on alignment, how the CANs as a tool fits into your child and family team process and practice at a local level. So I'll just pause a moment if there's anything that our regional training academies would like to add to that. Well, feel free, if anything comes up, go right ahead and add, but and let us know also if you, anyone on the line has questions about who your regional training academy is, who your contacts are, or if you're looking for more information on how to actually access that training, feel free to send us an email. Then the last piece of our update that we wanted to share, and I will turn this over to you, Chuck, to speak to the funding for CANs, the trauma questions from the DHCS side.
Thank you. This is Chuck Anders from DHCS, and with respect to reimbursement for implementing the trauma module within CANs, the Department of Healthcare Services wouldn't be reimbursing the non-federal share for costs incurred to administer the trauma module. It's not part of our the performance dashboards that we're implementing, and it wasn't part of the budget estimate that we had developed, and wasn't part of the CANs assessment that the department had adopted. To the extent that there are staff within the mental health plan who are involved in administering the trauma module, it's still an eligible cost as part of an assessment, but and eligible for federal reimbursement, but not to be included in the claims for general fund that we've set up for the CANs administration.
So it sounds like you're saying that it's not reimbursable under the CANs bucket, but is reimbursable under the assessment frame?
Right.
Okay. Good news. Yes, that is good news. And I'll just invite folks, if you have questions about how that works or need more particulars, please raise those.
Hi, this is Amanda from Santa Clara County.
Hey, Amanda.
Hi. So we just wanted a little bit more clarification on that, because the CANs, as we know, is done in collaboration in one. So how does one split that if, you know, the 50 items are covered, but the trauma items and potentially other items that we might have in our CANs are not covered by that cost?
I think you could time study. I mean, that's something that you and the county will have to determine how to separate out the cost. But this is part of, I think there are a number of complications associated with trying to separate out what's an increased cost to a mental health plan under Medi-Cal and covered under Prop 30 and what isn't. And this
I think that's kind of the complicated factor is those items are not necessarily done in seclusion or outside of the other items. They all overlap. So I think that's what we're getting at is there's no way of doing a time study to say how long does it take to do these items versus those items.
That makes sense. I know in some counties, and maybe those of you who have worked this out could share what agreements you have worked out. But in some counties, there's one agency that has agreed to take the lead, and so then that agency would be the one that was seeking reimbursement for those items. Is there an agency that has worked through that piece and come to an agreement about how the trauma items will be handled? Okay, so that is something that we're going to add to our follow-up list then to share more specifics and share some recommendation on how you might approach that. But thank you very much, Chuck, for providing some clarification that the trauma items can be claimed through the assessment piece, but not under CANS.
Lisa and Chuck, it's Richard. I just wonder if we might anticipate some written directive to that regard in terms of being able to bill and potentially time study to the assessment portion under Medi-Cal.
So Chuck, I think perhaps we can discuss that offline and circle back.
Yeah, I think that would be appropriate.
Okay, great. We'll do that. Thank you for raising that, Richard. So now I'd like to move us into the regional questions. So we'd like to start with the northern region. So if you are a county or an agency or an individual who is in a northern county, we invite you to please unmute yourself if you are on mute and go ahead and ask any questions that are coming up or share anything that is working for you or that you're in process of that you'd like to share.
One question we did receive from Northern Region was about CANS automation. Will it be linked to the CWS or will it have to be uploaded manually?
So Sinultra, would you like to address that?
So Kim's on the phone if you can respond.
So the question was around CANS automation and if that would be linked to the Child Welfare Services case management system or the new Child Welfare Services CARES system. The CANS automation. Okay, Sinultra, thank you.
Sorry. CANS automation, the CANS application that we're building is built within CARES, so you would have to have access to CARES in order to get to our CANS application. So it is already a part of the CARES system, so to speak. It is not. It does not save information to the legacy CWS CMS system. And I have not heard of talks of doing that because we intend on building that within CARES, at which point it would link up to CANS.
Thank you. Okay, other questions from the northern region?
Well, FFAs have an opportunity to access data from shared clients for outcome purposes.
I'm sorry, can you repeat the question?
Will FFAs have opportunity to access data from shared clients for outcome purposes?
That is actually a question for another product owner and team. That is for, so let me back up. within CARES, another application that we're developing other than CANS is the is the Facility Search, which is a tool that allows users to look at facilities, including FFAs, placement homes. So I don't have a lot of information about that particular product. There's another product owner that would work on that and would know those details. So I could take back the question, or Lisa, I'm assuming you're getting the questions, at which point we can respond in writing later. Is that how this works?
Yeah, questions that are submitted to us in writing, we are responding to in writing. We're trying to address questions in real time, though, so that's why we have everybody unmuted so that we can talk through things. But something that we can't address during this call, we are taking back, and we'll circle back at our next call through an update.
Okay, yeah, if you don't mind sharing that with me, that question in writing, and I can forward it to the correct person here to ensure that you get the accurate answer. I don't want to speculate and give incorrect information at this time.
Great, thank you. So we will take that question back and circle back in our next biweekly call.
Hi, this is Kim Suderman, CBHDA, and I just joined the call kind of in the middle of Chuck's conversation. I was on phone, and so I shifted over to my computer and ran to another room. So I'm sorry for the kind of being behind in the topic. But I wanted to go back, if Chuck is still there, to ask a question of Chuck.
Yeah, I'm still here, Kim.
Okay, so I know that the comment about the topic of the trauma questions, you were talking about billing from a mental health plan doing the assessment, and therefore could bill for their assessment time if it included the trauma questions, correct?
Correct.
And so I just wanted to make sure everybody on the phone understood that that would mean mental health or their provider who they contracted with would be conducting the assessment. It would not include child welfare doing their process when they're developing their case plan, but it would be the mental health assessment billing EPSDT for the time. And if the counties did that, they would only draw down the 50% of federal match. They would not get anything more than that, and they would not include the percent for the SB 90 claiming. So counties, just want to make sure counties understand that by choosing to do that, they would not be reimbursed their whole expense. So that might be something, if county mental health is doing that for child welfare on the trauma questions, you might have a discussion about how that cost, how those costs would be covered for a piece of that. That could be a local discussion. And if a provider is doing it, the same thing, a discussion locally about how you would deal with that. And time study is one way. And the other thing is literally for the clinician to be tracking, which is similar to time study, but just be noting of their assessment time that they're going to claim, how much of it is about trauma, so that if someone, if they were going to be reimbursed for that portion, if the county plans to bill under assessment, which may be different than be billing through utilization review, which is still in discussion between CBHDA and DHCS. So for the mental health plans that are on the call, just know that how to bill and submit claims for all of that is still in discussion between DHCS and CBHDA, whether to bill utilization, UR, or whether you're going to bill through assessment through EPSDT. So I just wanted to make sure.
Thank you, Kim. And just a point of clarification that this just is regarding the 12 static trauma items. So I just want to make sure that that is not lost.
And this is, this is Chuck. I just wanted to clarify one thing on the claiming, which is while we have been in discussion with CBHDA on sort of alternative methods of claiming and reimbursement for CAN's implementation. There are currently the two approaches that we've talked about are the ones that are available. So counties that want to claim reimbursement can claim that through the UR2A claim. And if that's used, then those costs are reimbursed at 100%, both the federal and non-federal share. Or the county can claim reimbursement through the short dole Medi-Cal claiming system as an assessment, but they'll only get the 50% of federal funds. No, the non-federal share will not be paid.
Great, thank you for that. Are there other questions from the northern region?
Hey, Lisa, it's Lynn Paul. I want to follow up on one thing with Kim now that she's weighed in, Kim and Chuck.
Sure.
And Chuck, I'm sorry because I did have to leave the room for a second. One question I have, if you could clarify, can you bill EPSCT for assessment even if the child is not found as meeting eligibility for specialty mental health?
They don't need medical necessity.
¿No puedo creer que 3 veces le tuve que explicar?
Is it possible for whoever's got the music on to turn it off? It's really distracting.
If you're not speaking, please put yourself on mute. We did unmute everyone on our end, but we are hearing some background noise.
If they don't, I'll try to talk over it. If the beneficiary doesn't meet medical necessity criteria, then they can't bill for reimbursement except for except for an assessment used to determine medical necessity.
Okay, perfect. So that was my question: is could you bill assessment even if the time it took you to do the assessment, even if the child is not found to meet medical necessity? So okay, that's helpful. Thank you.
Yeah.
Thank you.
Put their phone on hold instead of mute, and so I think that's why you're getting that music.
Okay, yeah, I'll be sure to remind people about that at the beginning of the call next time. But just friendly reminder, if you're not speaking, please put yourself on mute. We are hearing a lot of background noise. So we're going to move to the Bay Area region. Any questions from the Bay Area region?
¿Sabes qué?
This is Kim from Solano. I have a question about the CANS automation, and it's about what the plan is for moving forward with mental health being able to enter that information. What's the timeline for that?
I'm going to repeat back what I think I heard is a lot of other noise. It's an ultra here. I think the question essentially you were asking what's the timeline for mental health roles to have access to CANS. Is that correct?
Correct, because at this point there's no plan for mental health to have access to care. So for mental health plans that are doing assessments, it's double entry point.
At this point, I don't have a specific time as to when, but I can tell you that we are doing what we can now to support when that decision is made. And what I mean by that is we're ensuring that we have the right security and infrastructure in place to support external users. And so that's been our focus at this point, knowing that in the future sometime we will have these new users to fold into our care system. Our leadership team here, they meet periodically to decide what our top priorities will be and what we will be releasing and what our scopes will be. And so until those decisions are made, I don't have anything definitive to share as far as dates go. but I can just tell you that we know it's coming and we're trying to prepare for it at this point.
So as a follow-up to that, is the use of the CANS automation required?
I think that's a policy type question. It's not required on our end, but I don't know if you want to speak to that, Lisa or Mary.
Sure. This is Lisa. I can speak to that. For child welfare agencies, the CANS automated system is being built within CARES, and that is our, along with the CWS CMS, that is our required case management system. Now, while we're still building out the system, we are also recognizing that in many instances, paper CANs may be completed. And so we have reached out to each of the child welfare agencies to find out how many offices you have so that we can work to support implementation of a scanning solution that will allow for a paper CANs to be scanned into the system without requiring manual data entry. So I know that's a little bit tangential to the question that was asked, but I did want to share that information as well. So for child welfare agencies, the CWS CARES and the CWS CMS are our required systems.
Sandra.
Okay, any other questions from the Bay Area?
Yeah, I have a question. This is Donovan from San Mateo County.
Okay.
I actually wrote this on the on my written as a written question, but our director was asking this morning. I'm a clinical supervisor for Children and Family Services here. We're behavioral health and recovery services obviously also going to be utilizing CANS, where it's focusing a lot on the CFT process. The question that came from our director was how community partners and judges and attorneys are going to be educated about how they can be educated about what CANS is and the value of CANS is going to be an integral part of our our CFT process.
Thank you for that question. So around the child and family team process, I'm glad that you brought that up. We are working very closely with the Child Welfare Directors Association to think through and develop a plan to support implementation of the child and family team process in a really robust way, and thinking about who all of the stakeholders are that need to be involved or need to be educated and informed about the process. So we haven't worked through all of the details yet, but stakeholders like the courts definitely are on our radar in terms of needing to connect with and provide guidance and information to. So I am seeing a lot of feedback from those of you on the webinar that there's a lot of background noise. So just want to ask again, if you're not speaking, to please put yourself on mute and not on hold. Thank you.
Can I ask specifically about the expectation or the state thought process about attorneys and participation presence at CFTs? Because we are getting requests from Parents and Minors Council to be present at CFTs.
Okay, yeah, thank you. So we did issue an all-county letter with Child and Family Team frequently asked questions, and attorney participation in the Child and Family Teams was one of those questions that was addressed specifically. And so I would refer you to that. Does anybody on my team have that letter number handy? Okay, well, while we look for that letter number, what we did say in response is that the child and family team is really intended to be built with professional, formal, and natural supports that are supportive of the child, youth, and family. And so if an attorney was to participate, the thing to consider is if they are a natural support to the child and family, and if they would be considered a natural support after there was no longer formal involvement with the child, youth, or family. Another thing to consider is that their participation, it would need to be really clear that that was not for purposes of discovery or investigation or litigation. So really being clear about their role as a participant on a child and family team. And the letter number is All County Letter 18-23. If you want to take a look, we're probably a little more succinct in the All County Letter, so I apologize for that, but thank you for raising that. Okay, so we're going to go ahead and move to the Central Region. Any questions from the Central Region? And I did get a request to repeat the All County Letter number. It is All County Letter 18-23. Okay, any questions from the Central Region? Okay, how about the Central Region? We'll go ahead and move on. I'm sorry, to the Southern Region.
Yes, hi, this is Paulette Crawford from Riverside County. Can you hear me?
Yes, we can.
Can you repeat what you said regarding the supervisor and manager training? What is the requirement you were saying?
Oh, so not a requirement, but a recommendation. So right now, because the Department of Social Services and the child welfare agencies are in a pre-implementation stage or early implementation, we're in the stage where we just really need to build familiarity with the CANs. There is a lot of background noise, so I just want to ask again if you're not speaking to please put yourself on mute.
Lisa, I really think that is someone who put us on hold, and so they're not hearing you remind them. Like the only way would be either for your staff to systematically find out, mute each person one at a time and find out who it is, or everybody hang up and call back in, because I think that's what's happened.
Yeah.
Unfortunately.
Yeah, I don't think we have a way to figure out who is making that sound. So we might just need to put everyone on mute. And then if you are ready to speak, we're going to have you raise your hand. Okay, did that take care of it? Okay, there we go. Okay, so it looks like everyone's muted now? No? Okay, we're working on that. So I'm sorry, so the question was around the recommendation for supervisors and managers to attend training. And what I was sharing is that we are early in our implementation efforts. And so really wanting to support folks in building familiarity with the CANs and thinking about and focusing on alignment of the CANs within the child and family team process and with other practices and processes that are in place and that need to work with the CANs. And so we're recommending that supervisors and managers attend the training so that they can begin to think about alignment and then begin to think about policies that need to be developed and how to support staff in thinking about alignment as well. Okay, so I think we took care of the background noise, but now we need to work on the interactive part. So we're going to try to be strategic about that. So if you have a question, please raise your hand and we will unmute you, particularly looking for folks from the southern region, but happy to entertain questions from everyone at this point. Okay, so we're going to unmute Terry Lynn Fisher.
She is. She's open.
So Terry Lynn
Hello.
Fisher, you should be unmuted.
Yes, this is Terry Lynn.
Hi there.
Is the CANS required for cases that are under legal guardianship, but they're only open for funding purposes? So we really don't have any involvement with the family other than the social workers who are assigned to go out because the cases are open for funding?
So we're really looking at the CANS as a tool to help inform case planning and to organize and build consensus around the needs and strengths of a family. So if it makes sense for a CANS to be completed for a family who's under legal guardianship and the case is only open for funding, then I'd say, yeah, absolutely, go ahead and do a CANS. But we're really looking from that lens of the case planning piece and recognizing that the CANS is replacing the Family Strengths and Needs Assessment and the Child Strengths and Needs Assessment. So in your opinion, would it make sense?
In my opinion, I don't think it would be necessary, and I don't think even if we found areas of concern, the families, they're for the most part stable. They report they're doing fine. They report they don't need our help and they don't need a child and family team meeting. So I don't think it would be necessary unless they specifically were amenable to it and wanted it, but we don't know what the state's requiring.
Terry Lynn, this is Rebecca. Are you talking about cases in which guardianship was established and dependency was dismissed, or dependency is in play?
Well, they stay open. Guardianship was established, and then they stay open just for funding purposes. Sometimes the caregivers don't want to close the case because they want to know we're still there and we're still providing funding.
Terry?
Yeah.
Are you there?
Okay. Yes.
A lot of times the court involvement, though, has been terminated, correct?
Yes. Court involvement has been terminated.
Dependency is no longer a part of this.
No.
Okay. Thank you.
Yeah, so then in that case, the state is not requiring a CANS.
Thank you.
Yeah.
Thank you.
Okay, so other questions?
Yes, hi, this is Michelle Kapp from Riverside. Can you guys hear me?
Sure can, thank you.
Oh, wonderful. Okay, so I'm curious because I know that there was some discussion around the automation and that CANS is being built into CARES and is not going to feed information into CWS CMS. But I'm curious with regards to if the state is going to need to pull any kind of data from the CANS, if there's anyone who is involved on the data side to ensure that that functionality is available if that's something that you guys are considering, or how that's going to work. Because if it's not going to feed into CWS CMS and you go through with the process of doing a scan, that's going to limit your ability to run any kind of reports from that. So I just wondered if that's something that has been considered, or if there's anyone with regards to like data in terms of CARES and or CWS that's involved in the project to ensure that if there are data reporting needs, that they're being accounted for.
Thank you. Sinultra, I want to invite you to respond as well, but I will say that part of the reason that our department selected the CANs, and I'm sure, Chuck, you can add to this as well, is the ability to track and manage outcomes over time. And so that definitely speaks to the importance of data from the case-specific lens, the worker lens, and the system or agency-wide lens, provider lens as well. So data and information from the CANs is of huge importance. While we don't have reports built on the CDSS side at this time, we definitely are looking to that in the future. And the beauty of the scanning solution is that it ultimately is going to connect with the CWS CARES system, so that we will be able to utilize that data as well from a paper CANs.
That's interesting. I'm just wondering how that scanning would take place, because generally if you convert a document into, let's say, a PDF or some other form, then the individualized data fields that you would need to be able to pull information from aren't going to be available because the document fundamental format has been changed. So, but if you guys have technical people that are working on that, then perfect. I just was curious as to how that would be handled.
We selected a vendor that has the software that does that. They will actually map it to the data elements so that it's capturing the data and mapping it or connecting it to the data element.
That's fabulous news. Thank you.
And Sinultra or Chuck, I don't know if you wanted to add anything to that. Okay. Other questions? Hands raised?
All right, Sinutra's raising her hand.
Okay.
Oh, where are you?
We are in the process of unmuting. I'm not sure. Sinutra, we're unmuting.
She has to enter her PIN. I don't know if she logged out, logged back in.
Okay, so a PIN may be needed, Sinutra.
Yeah.
Okay, anyone else? You can unmute. Hands raised. Their hands raised.
Okay.
Hi. My name is Chioma. I work for an FFA, and I want to know if the CANS is used by social workers or is it only for clinicians?
So the CANS was adopted by both the California Department of Social Services and the Department of Healthcare Services as the functional assessment tool to be used within the child and family team process. So it would be used by both child welfare and behavioral health.
Okay. All right. Thank you.
Hi, this is Colette again from Riverside. Thank you for answering my previous question. My other question, I have two more actually. One is related to the automation as well. When I had gone to one of the trainings, they had said that other platforms, such as the Pride Foundation's platform that some of the behavioral health agencies are using, would be compatible to upload the CANS tool into CWS CARES. Is that still possible?
So I think I have a point of clarification. So the Parade Foundation doesn't have an electronic health record or a portal like that. The Parade Foundation manages the certifications for anyone who's going to be completing a CANS. But we know on the behavioral health side, many of the mental health plans have established electronic health record systems. Is that what you're referring to?
Yes, I thought it was through the Parade Foundation, but I could be wrong. I just know that they had purchased like an external platform to utilize for their CANs.
So some systems are utilizing Objective Arts as that system.
That's it, Objective Arts.
Okay. So we right now we don't have interoperability. But Sinultra, I don't know if you can speak to what that might look like in the future. And Sinultra, you might have yourself muted. Okay.
It says I'm unmuted. Can you guys hear me okay?
Yes, thank you.
Hello? Can you hear me?
Yes, thank you. Yes, we can.
Oh, okay, sorry. Yeah, so just to make sure I understood, because I've been trying to get through to talk, and so I missed some of the questions dealing with some of the technical difficulties, but I think the question is, how are we pulling data from the county, CANS data, and saving that here within CARES or Legacy? Is that the question?
No, it was more about Objective Arts being utilized by agencies such as behavioral health, and that system being able to transmit that information into CWS CARES.
Okay, thank you. Yeah, so that has come up in the past. Essentially, that's being able to connect to external systems that counties may have out in their individual counties. At this time, we do not have a time frame as to when exactly we'll be doing that. However, I want to remind everyone that we're still in our infancy stages, and that's why we're really focusing on our infrastructure and our security, so that way when we are trying to connect to external systems, we have the foundation needed in order to really take on that effort. So that is on our radar. We have heard the need for that in the past, and we're just trying to gear ourselves up for that when the time is right.
Okay, thank you for that clarification.
And then also, since I have had some trouble unmuting myself, I wanted to go back on a question that came up regarding case plan and CARES and Legacy and how that kind of gets synced up with CANS data. I think, Mary, you invited me to respond to that question. So my feedback would be, right now, CANS data, you're right, does not save to Legacy. Couple reasons for that. One of the reasons is because there just is no place for CANS in Legacy at this time. Legacy is an old system, CANS is something that is new, and there has not been a decision made to update the Legacy system with this new directive. Instead, we're building CARES to incorporate the new CANS tool that's required. And as we move forward with building out CARES, there is a plan to have a case plan feature included, and the thought is that we would connect our CANS data to the case plan feature when we get to that point within CARES. So I just wanted to mention that is on our radar. It's coming up. And then another thing I wanted to mention, unfortunately I was on hold also earlier, I was on mute, about the scanning solution. So I know that what I've heard in my discussions with Department of Social Services, the scanning solution would be, there would be a way to scan at each individual county, and that data would be stored in one repository or one database for all counties, and then our CARES system would connect to that one database. And so in order for us to do all that and get to that point, we would be working closely with the vendor that social services has selected to make sure that there's some standardization on the forms that would be scanned and the data that would be saved to ensure that it is configured in a way that would allow us to actually pull and save the data here within CARES.
Great, thank you very much for that. Okay, so we had a question about how to access training for CANs. Depending on which county you are from, you would work with the Regional Training Academy. Chuck, for mental health plans and training, can you share how that would be accessed as well? We're going to make sure that you are not muted.
Shouldn't be either.
Okay. So I will say we are definitely encouraging
if Chuck's not there, can I ask a question?
Yeah, but let me just say we are definitely encouraging training from an integrated perspective. So for behavioral health and child welfare and juvenile probation, if you are taking part as well, to receive training together is really ideal so that you can begin to think about how to get to a place where you have a single CANS that's completed in your CFT process. So yes, thank you. Questions?
Alexandra from South Orange County. Can you hear me okay?
Yes, I can. So you're from Orange County?
Yeah, from South Orange County. I'm kind of new to this, so forgive me if this question's rudimentary, but I have been listening in on the CANS webinars. I'm in the process of starting an SPRTP. So in my program statement, I wrote and incorporated CANS. I really like the process. But I'd like to understand it more, and when I went to the Parade Foundation website and contacted them, set up an account, I'd like to be able to take these trainings, you know, so I can understand how to implement this into my new program. So you said to contact Regional Training Academy. You know, I'm not familiar. So if there's more specifics that you could give me about how to attend more trainings. I've been listening in on the webinars. So I really want to familiarize myself with this.
Oh, great. Okay. So as a short-term residential therapeutic program, your role in the CANS would primarily be to help inform, but you wouldn't generally be taking the lead in terms of completing the CANS unless that's the agreement that the child welfare or behavioral health agency had made with your organization. So I just want to make that piece clear. In terms of training, the Parade Foundation does provide trainings that you can sign up for. Or if you have a relationship established with your county child welfare agency or behavioral health agency, you might work with them to attend one of their scheduled trainings. But those would really be your primary options.
Okay, yeah, they said something about having a code that would make this training at no charge, but because I'm so new to this, you know, I don't really have those established relationships quite yet. So you're recommending that I contact the county to find out when their next training is through the county, which would be Orange County.
Yeah, so the county may opt to include you in that training, or they may be at a place where they are primarily focusing their training efforts on another population of their leadership or staff. So I would encourage you to just have that conversation. If they're not at a place where they can include you in their training, then I'd suggest that you reach out to the Parade Foundation to find out when they have a scheduled training. And there would be a cost to attend that, although you'd have to work that out with the Parade Foundation. Okay, so
from my understanding from the beginning, what you're saying is through my if I establish this SPRTP, I'm not necessarily required to complete the CANs. The CANs will be completed prior to is that the understanding? Is that correct?
So I'm saying you wouldn't be the lead entity in completing the CANs, but you would likely, if there was a child who was placed in your facility, then you or your staff who are working with that child would be informing the CANs to help share your story and information about the needs and strengths of that child or youth.
Yes, that's
and
why
so having familiarity with the CANs would be helpful. Yeah.
Yeah, that's what I assumed. Okay.
Okay, yeah, thank you.
Okay, thank you. Thank you so much.
Great. So I just want to thank everyone for your participation and your patience as we're working through our technology, trying to get to a place where we have an interactive conversation but without background noise. So we're going to continue to fine-tune on that and look forward to talking with you again on October 31st. In the meantime, please send us your questions via in writing to the 2 email addresses that are on your agenda. Thank you very much.